So this is the beginning of wound care, and I want to show you how I have things set up on the table so that will make it easier for you when you come in to set up yours for your table. Number one, I have sterile gloves, but they can be placed anywhere on my table right now because I'm not ready for them quite yet. I have my 4x4s pulled up to the edge. I have two 4x4 sterile individuals, and then I have Telfa pad and my ABD pad. I have those pushed down to the edge of the table because while we're getting prepared, I'm going to open them from the corner and open them away from me. So I want them pushed down to the edge of the table comfortably. I wanted to show you for checkoffs that we would have our sterile cotton tip applicators. For checkoffs, we can put them here and open them up, or we'll show you how they can be taped to the side of the table if need be. But those are placed here too because I want to have them opened and pulled back and creased so that they stay open. And that way I can access them with my sterile glove. I have tape so as to tape the wound afterwards. I'm actually going to pull the tape and put strips at the end of my table so that I can tape the dressing into place afterwards. It's really hard to tear tape when you have sterile gloves on, so I'll do that ahead of time, and then I will actually date and label and sign my tape before I actually begin wound care. So that will all be done and prepped prior to me undressing the patient. So that's how our table is set up. Just for a second, and then you can continue. Okay. I have my tape pulled, the edge of the table, if Ms. Clark will show you here. And then the last piece that I have, I'm not going to do it right now, but I would, not reaching over sterile, but date and time my wound care. So that part is done and will be the last piece of tape that I put on the patient when I'm finished. So for demonstration purposes, without touching, these are sterile. I opened and taped them to the edge of my table just to make it easier, but we don't want to be reaching over that. Once they're here, we're going to ignore that side of the table so that we don't reach over that. And then I have my garbage bag that is taped to this side of the table so that when I need to throw away, I can drop it into there. Okay, now we'll review our orders and make sure that the doctor has written for us to do wound care, sterile wound care, and then we'll make sure that the patient understands. And when we're going to ask them, we're going to ask them how their pain is, and if it's need be, we're going to medicate them at least 30 to 45 minutes before we do wound care so that that can have time to take effect. And then we'll explain to them what they're going to do. We'll gather our supplies as we've already showed you and get our table prepped. And then we want to make sure that the bed is in a comfortable range because I can't be sterile if my hands are below my waist. So we're going to bring the patient up to the height that is sterile and comfortable for me. My table is already at that position. And that's, we'll start opening things in just a second. To check you off, we want to make sure that you have your hand sanitizer and tell me that you're cleaning your hands in preparation of doing sterile wound care. Now, we have the patient up at a comfortable level. I've done hand cleaner, and now I'm going to put some non-sterile gloves on. And the whole time we're going to talk to the patient and tell them what we're going to do. We've already discussed their pain. We've given them pain medication. Can you tell me what your pain level is now, Mr. Jones?
It's 0.
I've checked the orders, the wristband, and asked the patient's date of birth, and they were able to answer all of those things for me. So now we're going to pull the cover down. We don't want to expose them beyond what's necessary, so we'll cover below the wound and fold that sheet down to just here, and then we're going to take their gown and we're going to fold it up and away from us And make sure that we tuck that underneath them a little bit. And what's the importance of that? The importance is during our sterile wound care, we don't want that gown to flop back and contaminate our wound. So to begin with, we're going to go ahead and remove the dressing that's already there. We're going to pull from top to bottom, release the tape. And the only reason I'm not wearing my mask is so you can hear me. This would be with mask in place. We're going to take off that top dressing, and we're going to examine the wound and see if there's any purulent drainage, any kind of redness that's around there. We're going to take a first inspection. Then we're going to take and remove the packed dressing and look at its drainage. Is there anything on there? What does it smell like? What does it look like? And we're going to do our first inspection of the wound. We'll do a little more in-depth one in a moment. Okay.
All right, guys, at this point, what Miss Joyce is going to do is assess the wound using the acronym RETA. She will assess for redness,
Slight redness,
edema,
+1 edema,
ecchymosis,
no ecchymosis.
for drainage,
We'll pretend there's scant amount of serous sanguineous drainage.
and approximation.
No approximation. Now, I'm setting up. I've got my table ready to set up, right?
Yes, ma'am.
Okay, so now I have my patient comfortable. Their pain level is 0. We have them draped. We want to keep them comfortable, so we want to bring this. We don't need to expose them just to here, but we also don't want this blanket flapping back up or the gown flapping back into the wound. So now we have everything ready. We're ready to open up our sterile equipment. And so I'm going to, for practice purposes, I've taken my applicators and keeping them sterile, have taped them to the side of the table closest to the patient. My garbage bag is on the other side of the table, away from the patient. So with plain hands, no gloves, I'm going to start opening up our supplies. So I want to hold the corner. This takes a little bit of some practice. And open. My ruler is on the corner of the table. Hold the edge. Open the package away from me. Hold the edge. Open the package away from me. Hold the edge. Open the package away from me. Hold the edge. Open the package away from me. And now I'm going to position these to where I can put on my sterile gloves. And I'll push them this way so I can put on my sterile gloves right there. Not touching. I'll position them this way. Okay, there we go. Only touch the edge. There we go. And there we go. Only the edge. Now I can take my gloves and I don't want them touching this. Open them. Grab my right glove. One step back. Grab my left glove. One step back. Now my gloves are in place. Take my paper, it's sterile in the center, and from waste, drop to garbage. Now I will maneuver my table, if need be, with my foot to get back into position. Now previously, I had poured water. Did we erase that part?
Mm-hmm.
I'm sorry, we erased that part. So I had previously, before sterile gloves, poured solution. We'll go over that in class. But right now, the solution is already in my 4x4. We erased that, sorry. And I'm ready to start doing measurements of the wound. I've taken off the old dressing, which I did with my other gloves, and now we're going to start to do some examination.
Now Miss Joyce is going to measure the wound.
I'm going to take the stick from above, and we're going to do length. And then I'm going to measure, making sure that I don't drag my hand over my sterile. I'm going to do measurement approximately 5 inches. I'm going to step back around, drop my stick. Now, Miss Ashley, which one next?
Miss Joyce will now measure the width.
So my stick from above, and I can move my finger down to right there. That's approximately, being careful to not drag my finger across, 2 inches.
Miss Joyce will now measure the depth and check for tunneling and undermining.
Depth, approximately 1.5 inches. I'm going to check for tunneling away from me. Closest to me. No tunneling or undermining.
Miss Joyce is now ready to dress the wound.
To do our wound cleaning, we're going to take a 4x4, a wet one. We're going to bring it up so the sides are brought up in the middle. It looks like a fortune cookie. There. The first swipe will be from top to bottom, on away from me. Drop. Next, fold corners together. The next swipe will be closest to me, top to bottom. Drop. The next will be down the center. Drop. And now we're ready to pack the wound. We want wet. We're going to take our 4x4 and we're going to twist. And holding that together, we're going to take one of our applicators, starting at the top of the wound. We're going to pack that down inside that wound. In real life, you could probably pack with 2, sometimes 3 wet sponges, but because these are very non-compliant stiff plastic, we're just going to leave it at 1 sponge. So now that we've done that, we'll step away, dispose of our sponge, and now we're going to place 2 4x4s over the top. And then apply our ABD. You want to grab it on the outside so as not to touch the wound. The tape that we tore earlier, we will put in place. Away from me. Closest to me. The top one, I will have my date, time, initials.
Miss Joyce, is that time the time you started or the time you finished?
That's the time I started the dressing. Good question. And then the bottom. And if need be, we can pull some more tape and secure better around the side. Now, sterile gloves to come off, but we can leave them. They're non-sterile anymore. So now we can clean up our table, put things away. Don't reach back and touch anything sterile. But now we can put our supplies away. And then the last thing we do is remove our gloves. We're going to release suction on this, and then we're going to take from the middle and we're going to pull down, which is easier said than done because my hands are sweaty. Gather in one hand, release suction, and pull down over, and now your gloves are ready to be disposed of. Sterile wound dressing.